COVID-19. 11 passengers from the Ruby Princess have died from COVID-19, with hundreds contracting the virus since the ship docked in Sydney last month. The government has rejected calls for the new JobKeeper wage subsidy to be extended to include casuals employed by a business for less than a year. Labor wants more casuals to get access to the scheme. The Attorney-General, Christian Porter, says the government's basing its definition of casuals on existing legislation. The British Prime Minister Boris Johnson is in hospital for tests after showing persistent symptoms of coronavirus. Downing Street insists it's a precautionary measure on the advice of the PM's doctor. Mr Johnson tested positive for coronavirus 10 days ago. And Americans have been told to brace for the hardest and saddest week of their lives as the death toll rises across the US. New York State has had more than 8,000 new confirmed coronavirus cases in the past 24 hours alone. More than 4,000 New Yorkers have died. And Australia is in a good position in relation to the spread of COVID-19 compared to these other countries, according to infectious disease experts. Casey Briggs joins us now to talk us through the most recent developments. Casey, how are we looking on the home front?
Well, we're looking increasingly like we're seeing more and more flattening. Here are the numbers just for today. Only 2 states so far have reported coronavirus figures. 57 out of New South Wales, 23 from Victoria reported this morning, and 80 in total. That brings us now to, across the country, 5,773 confirmed diagnoses of the coronavirus in Australia. Let me show you not that chart, let me show you this chart, which shows you the number of cases recorded each day, and we can very much see that flattening, that levelling out, that drop-off in new cases. That's today. Not all states have recorded, so that column will increase, but here we are starting to see the sorts of daily increases that we were seeing 2 weeks ago, a real cresting off. Now, there are two things that very much drive that. One, a massive drop in the number of overseas arrivals to Australia. They are really becoming a trickle now, and so, those being the primary, the single biggest source of infections in Australia, a drop-off, you'd expect to see a drop-off in cases. But the other thing worth keeping an eye on is the amount of testing going on, and there's also been a drop-off in that in the last 3, 4, 5 days, where we were testing as many as 8,000 people a day just in New South Wales. We're now down to about 3,000. So we are seeing a drop there. We know that the number of tests that are done is correlated in some way to the number of cases that you find, and so that would be part of what's driving it. We're still looking to see, is there some hidden local transmission that we don't yet know about, but very much a continuation of the last week today. These cases are continuing to flatten off.
And as to deaths from the virus, Casey, what's the latest?
Well, we've now recorded, and we're seeing an increasing number of deaths recorded in Australia. 39 now in total. 4 of those today, 2 in New South Wales and 2 in Victoria. We are seeing deaths from COVID-19 in Australia speed up. Yesterday there were, I think 5 it was, a couple of days earlier, another 4 or 5. So we're seeing the rate at which deaths increase go up. That's also corresponded with an increase of people recording serious cases. It obviously takes a while between contracting the virus, showing symptoms, and then developing to such a serious case that you need intensive care or hospitalisation. And we're seeing the number of people in ICUs and on ventilators increase at the moment. Especially over the last few days, so we can expect that the rate of this increase will sadly go up.
Internationally, cases in the US, they just keep going up.
They do. Let's go to a broad picture of the world. 1.2 million, almost 1.3 million confirmed cases around the world now. These numbers are a bit hard to compare. I say it a lot, but different countries test differently. Different countries are missing different people. A country like China, until recently, wasn't even counting confirmed cases that aren't showing symptoms. So these numbers are tricky to compare. But the US, 337,000 now. That's more than a quarter of the confirmed cases around the world. We've also got Spain, Italy and Germany clicking over 100,000 now as well. and we're coming up close to 70,000 deaths around the world. Italy and Spain continue to lead that list of recorded deaths, but the US is growing fast, much faster than Spain and Italy. At this rate, they will take the top of this list after not too long. That the US, particularly some of these areas we've seen massive outbreaks like New York, of really serious concern. Probably, it's fair to say, the epicentre, the hotspot of the world at the moment.
And so how is Australia tracking compared to these other countries?
As we said, it's always hard to compare these countries, different countries testing differently, but we do what we can. This attempts to compare trajectories of different countries. We've changed the scale. It's on a logarithmic scale so that you can more easily compare routes, paths, and also we've moved the outbreaks so they all start at the same point on our axes. This is Singapore, a country that won early praise for the way it handled this outbreak with widespread testing, widespread contact tracing. It's had a relatively flat trajectory, but cases are, they're seeing an increase again, a jump again, and cases are still of a concern. There might be transmission that we don't know about or a second wave on the way. This is a country like the US. You can broadly split countries. There's sort of two common stories here around the world. The Asian countries that lived through the SARS epidemic, the SARS pandemic, and have been much more aggressive with the way that they've tackled this, and Anglophone countries that didn't, who have seen a much steeper increase. Australia sort of started off on that Anglophone route, has been flattening out, has been a trajectory that looks a lot more like some of the Asian countries that we've seen. Good signs, but as we know, much more to keep an eye on, much more testing to be done, and much more vigilance to be had.
Casey, thank you. That's analyst Casey Briggs there with the latest on the numbers. Let's bring in Norman Swan now, the host of the Health Report on Radio National, as well as the CoronaCast podcast. Norman, what are the numbers telling you?
Well, pretty much what Casey was saying there. But if you look at it's great news, and it'd be churlish not to admit that. I mean, it's fantastic. It's exactly what we've all been aiming for. It means Australians have been doing the job that's been asked of them, and it's not an easy one to be socially isolated. But if you look underneath the findings that Casey was talking about, the reason why we're coming off and flattening is that overseas cases have dropped dramatically. So they're really coming off, even notwithstanding the cruise ship problems that we've had. They're starting to flow through the system, and overseas cases are dropping dramatically. And they're tugging down that line and flattening that curve. What's going up underneath all that is, and it's just a steady low numbers, but it's not changing that much, is a steady linear rise in community transmission. Different states call it different things. Let's just call it non-overseas spread. And some of it can be traced back to people who've come off a boat or a COVID-19 case, and some of it you just can't. And that just keeps on going up. And that's probably what's scaring government a little bit at the moment, is that small numbers can become very big numbers incredibly quickly, really scarily, and you've got to get on top of it really quickly. So we're not really making a big dent in those community transmissions. So the whole thing's coming down, but this line's going up. And there are three things that do that. Casey already spoke about them. One is testing, and probably what we need to do is extend testing towards people who've got any cough and cold symptom at all. Maybe we need to move to more temperature checking so that at least everybody with a symptom is getting checked. Not there yet with that. We just don't have the resources and the capacity to do that. Then isolation really strictly, quarantining really strictly, contact tracing really strictly. Not in that order. It's diagnosis, isolation, contact tracing, quarantining of contacts. And of course, everybody else socially isolating so that we're not spreading or catching COVID-19 virus in the community. Those things together are really going to bring it down. Because what you've got to think of now is if we are coming off the top, we need to control that non-overseas transmission, which requires even stricter measures probably. And at least we want to see some turn in that factor. But then you've got to think of what's the off-ramp here. Can we get onto the off-ramp in 4 or 6 weeks' time where we're down to very low numbers? And the answer, and Casey will refer to Singapore, is you've got to be really careful because you can get that second wave. But if we've got a really good testing regime, isolation and quarantining, we might be able to get to the point where slowly, over a period of weeks, let something off, let something else off, see what happens. we might be, and we're all socially responsible, we might be able to get to a point where, in a limited way, we get back to normal life.
So potentially we have that second wave already building. Is that what you're saying? But we need to get onto the testing. And do we have the capacity to do that? Do we have the tests?
Well, I understand that they're being ordered. It probably means GPs doing more testing in their surgeries or in their car parks. It means more private pathologists doing testing. It means really extending the base. It's already happening throughout the country. It already happens in some parts of Australia already. For example, around Bondi Beach, I think general practitioners are testing anybody with symptoms because there is such a cluster there. And I think it may be true in Melbourne as well. So already in parts of Australia we're doing that. I think that Western Australia is moving towards testing anybody with symptoms. So already that's happening. These are the things you've got to put in place.
Is the fear that people may become complacent as they see these graphs that showing that we're doing okay, and for the moment at least the hospitals are doing okay as well?
I think, again, that's what governments are worried about, is that people will lose focus. The problem here is we can probably only sustain this kind of isolation for a period of time. Parents with young kids are going nuts here. They're going, that's why they're out in the parks at weekend. It's not that they want to be naughty and break social distancing. It's just that they're going nuts being at home. And so there's only a certain length of time where we can sustain this sort of isolation. And that's the reality. So I think that we're doing our job. The job of government is to put that infrastructure in place to be able to move forward. And the other issue is masks. And so I think everybody's worried about complacency, that we relax the social distancing rules. And the thing about masks in public, two issues. One is that, if there were an unlimited number of surgical masks, it probably would make a difference wearing them in public, because it would stop the asymptomatic people spreading it to others. But we don't, and therefore we've got to keep those for doctors, nurses, healthcare practitioners, firemen, police, and so on. And then, what about cloth masks? Well, cloth masks may or may not work, depends what you wear over your mouth. Probably don't work that well, but they probably have a risk attached to them, which is that we lose our fear of social distancing, or becoming socially close, and we become lax. So if you like, we get a sense of impregnability just by wearing a scarf over our mouth, which is not deserved.
And so as to the proper manufactured face masks, will they have more of a role to play in the general community at such a time when our measures are being lessened, when businesses are getting back online and serving food, for example?
I think we'll get to a point where we do what's been happening in Asia for decades, which is that if you've got symptoms of a cough or a cold, you wear a mask and you wear it in public. I think we'll get to that point, and it's got to be a proper mask, not just a scarf over your mouth. And I think that if we really get to the point where we think there are a lot of people in the community with asymptomatic COVID-19, then we may need to use masks much more widely. But we simply don't have enough masks at the moment for doctors, dentists, nurses, and people with coughs and colds who want to protect themselves at the moment. We've got to get to that point where we've got plenty of them before we think of the general public. In America, they're suggesting wearing cloth masks. Fine, depending on what you wear and how thick it is, and also that you don't forget about social distancing.
Indeed. Dr. Norman Swan, host of the Health Report on Radio National, as well as the CoronaCast podcast. Thanks for joining us.
You're welcome, Gemma.